We have the good fortune today to have really one of my favorite physicians. Dr. Paul Anderson is a researcher and a clinician, a fellow well met, and has much to share with us that you need to know. So welcome, Dr. Anderson, and let's dive in, if we can, to intravenous nutrition and what's it good for and what are the limitations, and oral supplementation and how do they work together.
Great. Well, thanks for having me again. And yes, so intravenous nutrition, something I've been working with for 3 decades now. So I have a lot of background. I've used it in some human cancer research. So that's always, a very interesting thing to kind of cross over from clinical to research medicine. But the bottom line, I think, is in especially people with chronic illness or cancer, the idea of intravenous nutrition outside of the hospital type setting where it might be used is to, number one, bypass the GI tract. So you can often give more nutrient than you could take orally. And so you're getting it directly into the plasma with access to the cells. That's the short version of why you would do that. Another layer of that same basic setup is sometimes you want a pharmacologic dose of an agent, meaning it's still a nutrient, but you're giving a pharmacologic dose to have a process, complete or force a pathway or something like that. And most of the time you could not give those orally to get that level of uptake. So it's really bypassing the GI tract, but also getting direct access to the cells and the whole rest of your body. That's the big benefit of it. Um, I would say that, you always have to think of the realism of it. Most people who are healthy and have good digestive tracts and don't have chronic illness, unless they get dehydrated or something, probably don't need IV therapy with nutrients. So it's sort of patient and condition dependent, but that's the basics of it.
Well, when I was directing the Princeton Bio Center, I inherited an IV nutrition department, and we would measure peak ascorbate and then trough ascorbate before the next infusion. And sometimes I was surprised at how much we needed to get therapeutic peak levels and still have beneficial trough levels.
Mhm.
Now, for a variety of reasons, most of the research that's been done has been with once a week or twice a week IV. What we found at the BioCenter was we got much better results if we could do IV at home on a daily basis, sometimes 2 or 3 times a day.
Mhm.
Um, what's your feeling?
Yeah, and again, it all depends on the desired outcome really for the purpose. So, and we've certainly done that in cases where we could get home health care set up and home
Yes.
nursing, et cetera, because there's logistical things around that. Um, there's sort of two ways especially when you're looking at high dose vitamin C, which we would use to do two things really. Well, there's about 10, but two big things. One would be to have a oxidative burst that would be immunologically helpful, usually in cancer, but some chronic illness. And then the others are really, as you noticed, you have these peaks and troughs with a water soluble like vitamin C are rather quick. Um, and so what's going on is that you don't see on the peak and trough curves is the normal cells in the body also are going to really love the vitamin C and take it up and hold on to it, especially in the mitochondria. So you're getting sort of this dual benefit. One is pharmacologic with maybe a tumor bed, et cetera. The other is really supporting the normal cells. Um, so if you're attempting to try and have that oxidative burst effect, you have to have quite high levels, really. And because it distributes so quickly and all your normal cells literally soak it up, If you're trying to keep that, yes, you might have to do multiple doses during the day to keep it up. There's a slightly different analog that we did during COVID with people in ICU, and that was we would put it on a pump and have so much dose every hour, and then you obviously could see the levels go up and maintain. But of course, they're not going anywhere. They're in an ICU. Most patients aren't. You don't have that access to them.
No, but I think for a moment we should talk about atrophy of the human GI tract, enteropathy.
Hmm.
We see it increasingly in society for a number of reasons, but the assumption that your human GI tract can take up, first of all, digest, assimilate, and eliminate the nutrients efficiently
Yeah.
is true if you're healthy.
Right. Right.
But I think enteropathy is very common and commonly overlooked.
Yeah. Yeah, and I think that's one of the reasons why very early on with my chronically ill patients, we started doing IV nutrient therapy. Was there's literally no chronically ill person who has a healthy GI tract.
Right,
They're mutually exclusive, really.
right.
And that was my first revelation was, well, they need all of these things, and there's no way I can put that in their GI tract at any level and get anything out of it. And of course, then we would see much better, clinical outcome. Um, and especially in either chronically ill folks with no cancer or people in remission from cancer whose system has been wrecked by chemo and radiation things, they can't digest and absorb like a healthy person would. So I do think I always tell people, although it's getting a little dated as an analogy, it's like if you overdraw your bank account and you're minus $100. Well, you can't even get to zero until you fill it back up with $100. Well, the IV is trying to do that, and we're trying to go around, the reason you got overdrawn in the first place. Um, and the other thing that I'm sure we've all seen who do it, there's a feed forward positive effect where once you start to fill the tank, so to speak, and you get nutrients into a person, the GI tract also gets those nutrients and it will heal and then it'll start to work normally.
From
Um,
the inside out,
from
not
the
from the
inside
outside
out,
in. Okay.
literally. Yeah. Yeah. So, beyond high dose vitamin C, there's a huge amount of benefit to vitamins, minerals, and amino acids, all the things that are the building blocks of us being
Well,
healthy.
Alan Gaby recommends the IV protocol that his mentor in Baltimore,
Mhm.
I'm blanking on his name, but I can see his face. Anyway, do you have any point of view on that cocktail
Yeah. Yeah.
of nutrients?
Yeah. So, yeah, if people are interested, they can search Alan Gabian. It's Dr. Myers, the late Dr. Myers.
Myers, yes, thank you.
Yeah, from Baltimore. Um, and the background of that was a lot of patients that he was seeing in tertiary care, nursing homes, et cetera. And he would do high concentration nutrient IV pushes because that's, of course, a lot easier at least on the provider side. It's a lot easier. The idea being it doesn't take a long time. You're not giving a lot of extra fluid, and they're getting this, large burst of B vitamins, largely a little bit of vitamin C and a few minerals. And I can say, especially early on, I've done hundreds, if not thousands, of those sort of things. They're quite helpful. Um, if a person has the time or they're, in an outpatient setting, one of the things I found as I looked at, okay, that model of kind of low volume, high concentration, which can do a lot. Sometimes the veins aren't as happy with that, as a larger volume. But the other thing is, if you kind of split the difference between what you might do with a hospitalized patient, where you're giving, a large volume over 24 hours versus, 30 to 50 cc's in a push, somewhere in the middle, what we found with a lot of people, especially the chronically ill patients, is let's give more volume up to say a ½ liter or something, put kind of the same mixture, maybe a little bit extra because we can. And so they get a bit of fluid with it. And also the nutrients go in a little slower, maybe over an hour, hour and a half, 2 hours. Uh, and I think clinically we saw better vein tolerance, but also really better outcomes because we could start to put things in, such as amino acids and things that Dr. Myers couldn't really do in the pushes very well, and they weren't really terribly available then, um, and get more of a benefit. So it's sort of splitting the difference, really. But yeah, if you have the option of nothing or to do a push like Dr. Myers developed and Dr. Gavey published, I would certainly rather have the push, than not getting the nutrients.
How about if we talk for a minute about ankylosing spondylitis and Norman Cousins?
Mm.
Because I'm not sure, even you might not know all the little details, but his doctor, Jeffrey Herzig, and I were working on his case, and we thought that intravenous vitamin C would be helpful.
Mhm.
We could not get the IRB at NIH to approve it. So he was checked out of NIH and checked into the Hay Adams Hotel, where he watched reruns of Candid Camera and laughed and received 50 grams of vitamin C twice a day by vein and went into remission. And then, and you may know this, but he then went to UCLA and started an interdisciplinary program because he felt that most doctors didn't know anything about what really was going on, and more importantly, what would cause remission.
Yeah, yeah. So I only knew portions of that story. So thank you for that. Um,
No, I think
yeah,
it illustrates the fact that the diagnosis was correct. It was an autoimmune
sure.
attack on his infrastructure, on his connective tissue, etc. And the prevailing therapies at that time were pretty risky themselves. So when the IRB said that vitamin C was unproven, because
Yeah,
it did lack large-scale
yeah.
long-term trials, we didn't disagree that this was a Hail Mary pass on a guy who was looking like he's going to pass. So my point is that, and I think you've been pointing to this, that autoimmunity, digestive irregularity, are becoming so common today that we need to prime the pump, whatever you would say. And I'm glad you pointed out that the push is easy but limited. And today, if possible, you should do a therapeutic trial of just the kind of IV nutrition you're suggesting. And how long would you recommend for a therapeutic trial just to see if improvement is possible?
Yeah, that's always the $1 million clinical question. And so when I'm teaching this and the providers will ask, well, how many do we do before we decide it's great? It's always I tell them it's a spectrum. So if you have somebody who's on the healthier side of chronic illness and maybe 1, 2, 3 years ill, but most things are working well, you might be able to see changes by doing 1 or 2 IV nutrient therapies a week for a month, 6 weeks. I've had patients, though, on the other end of the spectrum where they've been sick for 30 years and we're sure their gut is doing nothing. And their ferritins, the stored iron is 2 and it's been 2 for 20 years. And, so you're not going to take that person, and they often will feel better that day that they get the nutrients, but like you're not going to pull them out of that hole after 30 years in a month. So what we will do, and it's an analogous answer to IV vitamin C a little bit, but with nutrients, I'll first see what the patient can do schedule wise and all of that. But if they're very sick and they could do at least twice a week, ideally 3 times, but if they could at least do twice a week, I'll tell them let's say they're in the middle of that spectrum, not sick 30 years, but not sick 1 year. Um, I'll say let's do this for 6 to 8 weeks, and we'll check in with you, obviously, but just know that we're filling a very deep hole, a void that you have. So you may feel better, maybe worse after an IV nutrient therapy, but it's going to even out. What we want is we want the trend to be upward. So at about 6 to 8 weeks, we should see something persistent sticking, as it were, sometimes sooner. Um, and with, for example, the people who are 30 years sick and they have no iron left in their body and they're nutrient depleted, I've done twice a week for 3 months, and then they start to perk up, and then you can go to weekly, etc. A recently ill, meaning 1 or 2 years, chronically ill person, you might do that for 4 weeks at twice a week, and they're really perking up and feeling better because their body was. I always tell them you're closer to having normal physiology if you've just gotten sick in the last couple of years. At 30 years, your body doesn't remember what normal is. So, they might perk up, and then we might say, okay, let's move it up to once a week and see how we do there, and then twice a month. Interestingly, in the NIH trial that we were doing with IV vitamin C, one of the big questions was in cancer, when do we know whether we should move on and do something else, with vitamin C? Well, that question wasn't really clearly answered. And what we did at the end of, I believe it was 2 years, is looked backwards and said, okay, of those who had positive versus negative response, what was the number of treatments with IV vitamin C where we could call that's a durable positive or negative response? And it turned out that that was about 15 to 20 IVs. Anything before that, and there was no way to know. There was just no way to know. So then we were able to sort of, reliably tell people, well, there's a ramp up period we're going to do and all that. So you're going to do about 10 weeks at twice a week or less at 3 times a week. And then we'll decide, is it something that's a base therapy and we're adding on, or you're doing great, let's leave it alone, or maybe we should move on to something else. Yeah.
I sometimes ask people how long they've been sick. And I suggest to them it'll be about a month per year to recover. Because I don't want to give the illusion that in 20 minutes you can reverse 20 years.
Right.
But it's not an infinite gerbil on the mill.
Yeah.
It is an opportunity to restore, to renew, to rehabilitate the hormones, the neurochemicals, the immune defense and repair system, the microbiome, the metabolome, the detoxification pathways, and all of that remarkably can correct. Our little book is called Thriving in the 21st Century. And I'm so glad to have had you again as our guest, informing us about what we need to know. And I hope that we can continue this conversation because
Yes.
we all are learning every day, and the world is better for having you in it. So thank you, Dr. Anderson, for informing us, for enlightening us, and for being you.
Thank you very much.